Hey, welcome to my channel. My name is Ken Hao, and today I'm going to go over the basics about Medicare, your options, how to navigate, especially with all the information that is available to you at your fingertips. All the different emails that you may be getting, all the different phone calls, and the endless solicitation. I'm going to break it down into simple terms and help you navigate through all the confusion. First off is if you're turning 65 for the very first time and you're getting on Medicare, or you're past the age of 65 and you had chose to postpone Medicare because you had an employment coverage and now you're getting on Medicare, you're wondering what do you do? First off, the first step, the very first step is you want to go to SSA.gov's website, at Social Security Administration's website. I'm going to walk you through this, and then right here you'll see Medicare. And then there's a table of contents in the left column that breaks down when you should apply, what happens after you apply, your Medicare card. And you can only apply for Medicare online if you are turning 65 for the very first time. And this is if you're not currently withdrawing Social Security benefit, because if you're withdrawing Social Security benefit at the age of 62 or prior to the age of 65, Medicare enrollment process is automatic. So you wouldn't have to do this. But if you if you aren't currently withdrawing Social Security benefit, then and you're turning 65 for the very first time and wanting to get a Medicare, then you want to apply online through socialsecurity.gov. You click apply for Medicare. The whole process only takes about 15 minutes. And as you go through the application, it's going to generate a reference number halfway through. Make sure that you proceed past that because you're not done there just yet. And for those of you who chose to postpone Medicare past the age of 65 due to employment, and you now want to apply for Medicare, the best way is you want to fill out a form. It's a two-page form. You can go to, it's called CMS 40B right here. And they have both English and Spanish. And then this is what it looks like. Application for enrollment in Medicare Part B. You'll fill this out, section 1, row 1, 2, 3, 4, 5, 6, and then you'll sign this yourself and then date it. And then you have a second form because Medicare has this rule that you're supposed to enroll into Medicare at the age of 65 unless you have employment coverage, because otherwise they assess a late enrollment penalty. And you need to submit proof and show that you had special election qualifying reason to be able to enroll Medicare past the age of 65. And it's a form called CMSL 564. And here's the English version, PDF. Request for employment information. You'll fill out section A by yourself, and then section B will be completed by your employer. And then once you've done that, you want to fax it into Social Security office. I can help you do that, or you can do it yourself. The best way is to utilize the Social Security office locator tool. Let's see here. Office locator. Locate an office by zip code. Now my office and I myself, I'm here in Utah, so I'm going to use that as an example. And then boom, you have your nearby Social Security information based on your zip code. Here's going to come up with the fax number and the phone number. So you'll complete both those forms. Again, that's CMS 40B and CMSL 564. Just Google this up, print it out, fill it out, and then fax in to the nearest Social Security based on your zip code. Now, once that's done, if you can create a Social Security account, and there you can track your progress. The whole process usually take about 2 to 4 weeks, so you want to make sure that you give yourself ample time to prep yourself, so that way you can also, enroll into Medicare, and after that, uh, go through your Medicare health insurance option and finding the right one to pair up with your Medicare. Um, so once that's done, you'll have your Medicare, and as you know, you get a lot of information, a lot of stuff in the mail. You're wondering who's telling you the truth, who to listen to. I think that the best way for you to start is getting yourself educated and informed first, and that you start that process through the Medicare and You guidebook. It's through the federal government, the government Medicare Handbook through Center for Medicare and Medicaid Services. It's 128 pages long. It goes through all the definitions of all the different lingo and slangs about reference on what Medicare is about, what they do cover and not cover, things for those example. But I'm going to keep this video simple and straight to the point. Is that Medicare in itself consists of two parts. It comes in this red, blue, and white card. Now that doesn't really show it. I don't know why that's blacked out, but Medicare card. It looks like that. It used to have your social security number, but now it does not. And Medicare consists of Part A, and Part A typically comes free if you've worked for 10 years in the United States or for 40 quarters. You pay towards your FICA taxes. So Part A comes free, even though you've been paying that throughout your life. And Part A with Medicare covers for inpatient care in the hospital, skilled nursing facility care, hospice care, and home health care. And see that it references you to page 25 through 29. You can click on it and it takes you right over there. That's my advice is that check the book out, but I'll walk you through this as well. And then Medicare Part B cover for services like doctors, healthcare providers, outpatient care, home health care, durable medical equipment, a lot of preventive services. So think of Part A, anything that are staying overnight or staying in a facility. Part B are typically same day service, outpatient. You go in, you come out the same day. And then there are Part D, drug coverage for prescription drug. Medicare in itself does not cover prescription drug coverage, so keep that in mind. And Medicare, again, consists of two parts, A and Part B, and typically Medicare only covers 80% of your bill, and there is no ceiling and no cap. Unlike employer coverage, most cases you have a cap. Once you meet that threshold based on all the medical expenditures that have been that's done throughout the year. Once you reach that, let's for example 5 to 6,000, let's say $6,000, you spent $6,000 out of your pocket. Anything beyond that is covered by the insurance company. Medicare itself does not do that. So you have the option of just having Medicare, but I never recommend doing that unless you're living out in a rural area where that is really the only option that is available to you. So now let's dive right into it, okay? Now, your Medicare option. First off, again, you can stay with Medicare only, but again, Medicare typically only covers 80% of the bill and you're left with 20%. And if something catastrophic were to happen, that's a lot of financial responsibility that you would have to shoulder. And again, that typically only applies to people who lives in a rural area. So the two other options that you can opt in for is keeping original Medicare and picking up a Medicare Supplement policy. This route here with Medicare Supplement, every insurance company offers one. United Healthcare, AARP, Mutual of Omaha, Humana, Cigna, to name a few, and these are all the big name company. And I always recommend, going with a company that has a good track record that you've heard of and that is reputable, because more often than not, you will find smaller insurance company that you may have not heard of offer you a more attractive rate. But the issue with these insurance company is they aren't able to spread risk like any of the larger insurance company can. Typically over the course of multiple years for the same exact coverage, you'll experience higher rate increases, usually in the double digit, and sometimes they'll even go out of business because they don't have enough clientele. So keep that in mind. And also when it comes to Medicare Supplement, they're characterized by alphabetical letter, Plan A through Plan N. And you may have heard of Plan F, Plan G, Plan N. They're all the same thing. They're standardized. Whether you picked Plan G through AARP, through Blue Cross Blue Shield or Humana, they're all the same thing. The only difference when it comes to Medicare Supplement company is the premium that they issue you and the rate at which they go up. And some of them provide additional coverage beyond the scope of the medical coverage. They give you additional things like silver sneakers, gym membership, some discount, vision and hearing, just like the small details. But overall, everything else, it covers exactly the same. So again, you want to focus on a company that's a good track record, it's reputable. Perhaps, a company that your friend or neighbor or a family member or your parents that your parents that are on Medicare had good experience with. That's what I recommend that you take a look into. Medicare Supplement, it costs a premium. It ranges around $100 to $120 a month. And backtracking a little bit, Medicare comes with a premium. Remember how I said Part A is free? Medicare itself has a premium. Your Part B is for 2022. It's $170.10. And keep in mind, it's actually dependent on income, and it's based on your IRS tax return from 2 years ago. So you want to keep that in mind. And a lot of people, they'll advise you on the standard premium rate, which most people do fall under that scenario. But in some occasion, if you make more, you want to be informed that you may have to pay more, or if you sold a property recently or anything like that. So if you file individual tax return 91,000 or less, or as a couple 182,000 or less, that's your premium. If you make more, it'll be adjusted accordingly. So make sure you just look that up, Google that up. But for most individual, you'll just be responsible for $170.10. Okay? So it's $170.10 with original Medicare. Medicare is your primary, which is the government. They provide you for your medical coverage for inpatient and outpatient services, and then you can go out and pick up a Medicare Supplement coverage through a private health insurance company. And again, that ranges between $100 to $130 per month, in addition to what Medicare premium costs. And that is dependent on the state that you live in, entirely dependent on the state. Some state for the same exact coverage may be more, it may be less. So it's important to shop your coverage and your option. Medicare Supplement is ideal for any folks who has pre-existing. If you consider yourself to have poor health, or you have family history of pre-existing condition and you're worried that you could be a recipient of that as well, the Medicare Supplement is the route that I recommend that you take, because it provides essentially 100% coverage after you satisfy your Medicare Part B deductible of $233 for outpatient services. Once that amount is satisfied, everything is 100% coverage. You don't really have any out-of-pocket responsibility. Unlike for most individual, your employer coverage, you have some cost sharing co-pays involved. Medicare supplement typically isn't the case. With certain plans you do, but it's, $20 for a primary care specialist visit. It's not that much. And also, Medicare supplement gives you complete freedom and flexibility. You can travel all around the nation and have the peace of mind that you'll get coverage. So if you're the couple or that person, the individual who plans that you're gonna go on a RV vacation, a tour around the country, visit all the national parks, um, Medicare Supplement is the route for you to take because you have a peace of mind that you'll be covered nationwide. A lot of employer coverage, right? They have a network. You may have heard the term HMO, PPO. Yeah, those term refers to your network. So if you plan on flying or traveling around and you're able to afford the additional premium of beyond what Medicare charges you, then this is the route that you want to go to. Again, if you have pre-existing or family history of health condition, this is the route that you want to take. And then here comes the more popular option. They're known as the Medicare Advantage plan. Nowadays, more and more people are leaning this way. A lot of the TV commercials that you see on TV that Joe Namath talks about, or Dynamite, you've probably heard of that one. They talk about getting your Medicare Part B reimbursed. I want to caution you that it's all dependent on zip code. With these commercials, they always try to paint a perfect picture to get a Medicare beneficiary to pick up the phone to call in. And a lot of time you'll find out that those benefit, about your Medicare premium being reimbursed actually isn't available to you. It's only dependent in certain areas. So just keep that in mind, okay? But Medicare Advantage plan, they're very appealing to a lot of people. And I would say that 9 out of 10 people that I meet or my client, this is the route that they choose to take. And the reason being and how it differs from this is this, okay? With over here, original Medicare, you have your Medicare is your primary, and then you have a secondary Medicare supplement that picks up 20% of what Medicare does not cover, and then you have a standalone prescription drug coverage for your medication coverage. Over here, you're trading in your Medicare Part A and B, essentially trading in for a private health insurance program. The private health insurance company becomes the Medicare administrator, and they provide you for your Medicare Part A and Part B coverage. And now don't worry, because all of the coverage here has to be at least as good as that of Medicare. It's entirely regulated by Medicare, and they set the rules that there's a minimum standard that you have to meet by these private health insurance company. So, for example, AARP, Humana, Kaiser, these are all huge insurance company, and the private health insurance program they offer provides you for your inpatient, outpatient services, and it may also include Part D for prescription drug coverage and some extra benefits, and these refers to dental, vision, hearing coverage, transportation coverage, over-the-counter items coverage, so things like your vitamins, your supplements, it falls under these extra benefit. And that's why a lot of people like it, because you have everything. Over here you have 3 separate ID card, and Medicare really just covers you for medical necessities if you think about it. They don't really cover for preventive stuff. Your annual physical, Medicare don't cover that. They cover your wellness visit, which is, half that of a physical. It's weird. But over here, when it comes to your private health insurance company, their Medicare Advantage plan, they're also known as Part C. It's all inclusive of your A for inpatient, B for outpatient, your D for prescription drug, and your dental, vision, hearing, and everything. the reason why a lot of people like it here is every plan and pretty much every insurance company in every county across the United States, they offer a plan that is $0. It doesn't have a premium. And you may wonder, that sounds too good to be true. Well, keep in mind, you know, you actually have cost sharing involved. Part of the reason why a lot of people find this appealing is it functions similar to an employer plan. Every plan has a network. It's an HMO, PPO, etc., or private fee for service. However, usually with the network, it's not a big issue. You just gotta make sure that the providers that you're currently seeing are in your network. Um, and as long as you're not going out of state, because even if you go out of state, you're covered for urgent care and emergency care. In some plan, you're covered out of state or out of network. But a lot of times, you gotta ask yourself, like, why would you go out of network anyway? Because if you go out of network, your cost sharing is going to be significantly more versus to you going in network. And in most cases, for most people, they have an established relationship with their provider that they've seen for many years or decades, and that's who they trust and who they choose to go to get care from, and they have a facility or hospital that they go to on a regular basis anyway. So you just want to make sure that those are included in your network and just to cover your basis, and finding the plan that provides the best coverage on your medication as well. And again, every plan offers a plan that doesn't have a premium, and all of them has a cap, a ceiling, an out-of-pocket maximum. What that means is if your bill was $100,000 and your plan only has a maximum out-of-pocket of $5,000, then that is the most that you'll pay for that calendar year for any medical services incurred. And then anything beyond that is covered by the insurance company, and it resets at the beginning of every calendar year. So yeah, the main difference is that with this you pay $170.10 plus another between $100 to $130 for Medicare Supplement and a separate premium for your prescription drug. Overall, you're looking at about $320 on a monthly basis for essentially 100% coverage. And then over here, you're only paying the $170.10, and then you're not paying anything additional. You don't have any additional premium taken out of your social security or being billed to you or coming out of your bank account. The only responsibility is you have cost sharing involved for each services incurred. So let me pull up for an example. I'm going to go to Medicare.gov, and here you can find the plans that are available to you. Find plans here, and then we're going to put in put in zip code. That's where I'm at. And I'm just going to skip past putting in prescription drug for now. But here in the state of Utah, there's 26 Medicare Advantage plans available. It shows all the different star rating Medicare Advantage plans. So for example, right, $0 premium. Let's do Select Health. AARP, $0 premium. Blue Cross Blue Shield Regions, $0 premium. And let's just say we go to this plan right here. So your out-of-pocket maximum is $4,900. That's the most you'll ever pay for the calendar year for medical services incurred. And then with most services, your lab is $0, outpatient x-ray is $15, your specialist visits $35, primary doctor is $0. They're all very minimal. The biggest cost sharing as it relates to your Medicare Advantage plan are typically your overnight stay inpatient and outpatient surgery. Because look at that. Your inpatient stay is $345 per night from days 1 through 5. Outpatient's about $325. Preventive services are all 100% covered. Ambulance, $280. Occupational physical, $20. With most things, they're very minimal. It's the big items that are overnight stay and outpatient services that will cost you more out of your pocket, and all that will go towards your max out of pocket of that $4,900. And this is Utah. Utah tend to have a higher out of pocket maximum. In other states, they're tending to be a lot lower. Let's move on here real quick. I want to talk about, with the Medicare Advantage plan, you can have the option to mimic the coverage that you have with this for a lesser and pay lesser out of pocket. Because remember, the biggest costs associated to Medicare Advantage plan are your overnight stay and outpatient surgery. You can pick up an optional hospital indemnity type policy that would cover your inpatient copay and outpatient copay. And those plan costs probably about an additional $30 a month. And if you stayed overnight in a hospital or went in for an outpatient surgery, those items, your cost sharing would be completely covered for. So even though this plan doesn't have anything, right, you have cost sharing involved. You can pick up an optional supplemental policy called hospital indemnity, and all the biggest costs as it relates to your inpatient overnight stay, outpatient surgery, and your ambulance, all those will be 100% covered, and then you would have no out of pocket. And that's only an additional $30 to $40. So in reality, you can go with Medicare Advantage route. It's $170.10. Pick up your primary insurance coverage through, let's say, for example, AARP United Healthcare. That's $0 premium. And then you can pick up a hospital indemnity supplemental policy to cover those holes and gaps on your primary insurance. And that would only cost you an additional $30 to $40. So overall, you're only really spending about $210 per month in cost for total coverage for hospital, medical, for prescription drug, dental, vision, hearing, over-the-counter, all that all-inclusive, right? So all in all, the deciding factor really comes down to this. Which route should you take? If you have the financial means to afford a Medicare supplement and you plan to travel and you don't want to deal with co-pays, out-of-pocket expense, and paying a fee each time a service is rendered, then Medicare Supplement is the route for you to go with. But if you're the person who I feel like, who is proactive with their lifestyle, conscious about your food intake, your quality of life, then this route is the way to go because it allows you to pay a lesser premium and have complete coverage and have it be one ID card and be okay with network, because the network really isn't a big deal, because with most plan, all your doctors and facility, you're going to find an option that cover all of your doctor and hospitals that you go to. It's just a matter of finding one that is, that will be the most effective in terms of providing you with the coverage that would lower your financial expenditure versus other company, and also just better customer service overall. So again, that would be the best route for you to take if you like having additional benefit of dental, vision, hearing without having to pay a separate premium like you would over here with original Medicare, and you like that the idea of all your preventive, like your colonoscopy, your annual physical exam, all of that 100% cover. Your preventive are always 100% coverage. Part of the reason why Medicare Advantage plan costs less, or they're able to offer it at a $0 premium too, is because it's all about early detection, right? Prevention is better than cure. You may have heard that saying before, and that stands and applies over here on the Medicare Advantage route. So again, if you have the financial means and you're traveling a lot, you have pre-existing condition, and you don't want to deal with copays, original Medicare is the route that you want to go. But if you want complete coverage, lower premium, have additional extra benefit, Medicare Advantage plan is the route to go. One thing that I want to bring to your attention though is the best time to enroll in Medicare, because you can change, right? Go back and forth. You have that flexibility. But one thing that you want to keep in mind is that when it comes to Medicare Supplement, the best time to enroll in it is when you're getting on Medicare for the first time. Because if that is not the case, after that, in order to get on Medicare Supplement plan right here, you have to go through underwriting health questions. The insurance company can underwrite you for a higher premium or straight up deny you based on your current health condition. So keep that in mind. Uh, Whereas over here, it does not have any health question. You can get on this without having to worry about health question. And let's see if there's anything else I'm missing. Yeah, and another thing is about late enrollment penalty is that sometimes you may get letter from insurance company talking about late enrollment penalty. This is if you did not have prescription drug coverage since being Medicare eligible. They will assess a late enrollment penalty, and that penalty is attached to your premium for the life, uh, for as long as you're alive. So you want to make sure that if they send out a letter and the date that they say that you didn't have drug coverage, we want to make sure that we're attentive to it and provide proof that you did have credible prescription drug coverage so that they can remove those prescription penalty, late enrollment penalty. I'll make another video more on that later. But for now, I hope this has been helpful to you. My name is Ken Howe. I run a Medicare agency helping seniors and people that are 64 and under with their health insurance. I've been doing this for 8 years now. And yeah, give me a call if you ever need help. I don't just sign you up and disappear. It's not a one and done deal. I actually provide an ongoing year-round customer service. You have access to my personal cell phone. Most people don't do that. Perhaps I'm crazy for doing that. I pick up phone calls on the weekend as well. I have a promise with everyone that I work with is I'll always get back to you within 24 hours. When we work together, I want to be that person where you feel like you can place your confidence and be able to rely and depend on. Because the unfortunate truth about today's world is you get a lot of phone call solicitations. Some of them you can tell they're not even from the United States, and a lot of times it's hard to communicate with them because they don't understand the context and the slang that we use. So it's nice to work with someone who's local, who's here. You know what I mean? Just like how you have your doctor for your healthcare need, I'm your guy to go to for your Medicare and health insurance needs. So please consider me in your Medicare plan option. I would love the opportunity to be able to serve as your agent. Thank you for stopping by today and watching my video. If you like this video, please like and subscribe. And if you did not like, please leave a constructive criticism and how I can improve so that I can better my video in the future. Thank you very much.